Good afternoon. Today is Wednesday, April 15th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. With me today are Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department, and Dr. Dwayne Tull, Chief Medical Officer of Oswego Health. Yesterday, we reached a threshold in our county. We now have twice as many people who have recovered from COVID-19 as we have active cases. More than 1,000 of our county residents have been tested for the virus. Far and away, most of them tested negative, and they do not have coronavirus. As of yesterday afternoon, 944 people have been released from monitoring. Since we had our first positive case about 4 weeks ago, our county health department has worked tirelessly to investigate and track cases, monitor our sick patients, and prevent the disease from spreading. On behalf of the county legislature, I want to personally thank our public health team, our public health director, Jin Chang Wang, our medical director, Dr. Christina Lipke, and our healthcare partners for all their hard work. Their efforts are now paying off. Now I will call on Diane Oldenburg to provide today's daily numbers.
Thank you, Chairman Weatherup. As of today, 1,041 residents have either been tested or are scheduled to be tested. We've had 48 positive test results come back. We've had 931 negative test results come back, and we have 57 test results that are still pending. We've had 30 residents that have recovered from COVID-19, and we've had 2 deaths due to COVID-19. Currently, 82 residents are on precautionary quarantine, and 82 residents are on mandatory isolation or quarantine. Thanks.
Thank you, Diane. Today we have as our guest Dr. Dwayne Tull, Chief Medical Officer of Oswego Health. Oswego Health is an important partner in our county's COVID-19 response activities. I invited Dr. Tull today to share information about the new walk-up triage center for respiratory patients at Oswego Hospital.
Thank you, Chairman Weatherup. Thank you, Diane. By now, many of you have noticed the structure we are building outside the emergency room on 7th Street. We are working on setting up an outdoor triage center and respiratory treatment center to better serve and protect our community. With this center, we will be able to properly triage patients before they enter the facility to better protect all of us. We plan to staff the triage center between the hours of 10 a.m. and 10 p.m., of course, weather permitting. During that time, all patients to the ER will enter through the triage portion of the tent before entering the emergency department. They will be met by nursing and a provider to evaluate and triage them appropriately. If a patient is noted to have symptoms suggestive of COVID-19, they will be positioned in the second portion of the structure to begin treatment and help isolate them from other patients. If their illness is such that they need further treatment, this will give us the time to better prepare isolation procedures to bring them into the facility in a safe manner. If a patient comes to our facility with no fever, cough, or symptoms, and no history that suggests exposure to COVID-19, they will be cleared for entry into the emergency department through the normal facility doors facing 7th Street. We are working on the details of this process and beginning trials today. As we get this equipped and we have the process worked out, we will formally announce the new pattern to everyone. We are doing all of this to help protect our staff and our community. Thanks again for allowing us to participate today. Remember, please continue your social distancing, wash your hands, and stay safe.
Thank you, Dr. Tull. Our partners at Oswego Health have spent the past several weeks preparing to accept and care for COVID-19 patients. We appreciate all the work to meet our community's healthcare needs throughout this pandemic. In closing, I would ask you to please continue to practice social distancing and use reliable sources of information. The health department's COVID-19 hotline is 315-349-3330. This hotline is staffed every day from 8:30 a.m. to 4 p.m. Go to health.oswegocounty.com/COVID-19 For the latest news releases, daily updates, and video presentations, or visit oswegocounty.com, and please share this with your social friends. We are all in this together, and once again, I thank you for your continued patience and cooperation.